passionate about is stones, Manchester United, unfortunately, the India cricket team, which is all right at the moment, but I'm very passionate about stones. And you know, ureteroscopy is something that I think a lot of trainees come through and think, well, anyone does, everyone can do stones, right? We can all do stones, okay? But there's a difference between doing stones and doing stones well, all right? And that's where the learning comes in. So, you know, I don't need an excuse to have a picture of Nigella Lawson on my slides, but, you know, what is a recipe for a perfect ureteroscopy? There are some ingredients, aren't there? So you need a really well-prepared patient, an equally well-prepared surgeon. A lot of the work that I've done and research I've done is about patient preparation, which we'll talk about in a minute. You need some equipment, and you know, we're going to be playing with some later on this afternoon, and you'll all get the opportunity to get hands-on time. Really important to be familiar with your equipment. You need a bit of planning. You need some good fortune, okay? Good fortune is underestimated, but you definitely need that in surgery. And you need a plan B and a plan C, sometimes a plan D as well. And you know, my registrars get very fed up, but you know, before we do any operation, I always make them sit down and tell me the operation they're going to do in their head, and then what's going to be the plan B, plan C. I don't think you should touch a patient unless you've got the plans in your head. So preparation, three things really: know your patient, know your equipment, and know your limits. And I'd say know your limits is probably the most important one. Okay, so what do I mean by that? Knowing your patient is a very important thing, and you know, we have difficulty in Nottingham because we have a pulled list because we're so busy. So I may not have met the patient that I'm going to operate on. Very many of our patients are tertiary referrals, and I may not have seen them, and they've come a long way to have their operation. So it's really important that you get to know your patient, even if you haven't met them, but you need to know about them. Okay, and what do I mean by that? You need to know their comorbidities. You need to know what kind of stone they're likely to have had. You might not know that, but you know, many of them are recurrent stone formers. You need to know the anatomy and really look at the imaging. And you know, I always, again, my registrars really hate me actually, because one of the other things I get them to do is, whenever they look at a scan, I tell them to close the report and report it themselves, okay? Because a good endourologist is also a good uroradiologist, okay? We're very lucky, we've got excellent uroradiologists that actually feel more part of our team than they do with radiology because they work so closely with us. But it's so important to learn to look at the CT, and you know, as we've just heard the kind of 3D concept in your head that you can get